According to the American Cancer Society, prostate cancer is the second leading cause of death in American men. Every day, dedicated experts at the UK Markey Cancer Centre are working hard to change that. Markey is recognized among the nation's high-performing hospitals by US News and World Report, placing it among the top 10% of cancer hospitals in the country. Dr. Stephen Strup, chair of the UK Department of Urologic Surgery, recently joined our UK Healthcast series to share what you should know about prostate cancer.
So can we just start with an explanation of what is prostate cancer and why is it so significant?
It's significant because it's the most commonly diagnosed cancer in men, and it's one of our leading causes of death. And if you look across the U.S., there's roughly 280 or so thousand cases diagnosed every year, and it's something that men need to know about for sure.
So are there risk factors that increase the risk of a male developing prostate cancer?
There are genetic factors. We know that family history plays a big role. There are certain groups that have a higher risk. Black men have a higher risk of having prostate cancer. There are some we're getting more information about specific gene abnormalities that may track through families. Breast cancer, actually, through the BRCA genes, actually translate to higher risk for prostate cancer in men. So if mom had a family history of breast cancer, you may have gotten a gene that may impact you.
So at what age do you recommend starting screening, PSA testing, things like that?
If you're a man of average risk, meaning that you don't have any strong family history or other risk features, somewhere in that 45 to 50 years of age, you should consider starting with PSA screening.
What role does early detection actually play in the treatment of prostate cancer if it is early detected?
Well, it gives us more options. And so I remember back in my training, which was too many years to comment on, I guess, but we didn't have PSA testing. And so the patients that we would treat often came in, you diagnosed them just with a rectal exam, and they would have bulky disease. And so not shockingly, they didn't do as well. It was harder to control that disease. By screening, it's not perfect, but you can at least have a chance of finding that cancer earlier when we have options and have more options for local control and so forth. We know there's value in screening. We just have to do it carefully and smartly.